Good afternoon, everyone. My name is Janice Dumont, and I'm the Director of the Collaborative Specialization in Women's Health at the Della Lana School of Public Health at the University of Toronto and Women's College Hospital. And it's really my pleasure to welcome you to this webinar today, which is co-hosted by the Center for Global Health and the Collaborative Specialization in Women's Health at the Della Lana School of Public Health. I would first like to acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the Della Lana School of Public Health now stands. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We would like to pay our respects to all the ancestors and to our present elders as well. Today's webinar will focus on the impacts of COVID-19 on gender equality. As many are aware, the COVID-19 pandemic has impacted the health and well-being of women in significant and wide-ranging manner. From the overrepresentation, for example, of women in frontline healthcare positions to a lack of economic security as women have to choose between childcare and returning to work, to a stark increase in violence against women, particularly in intimate partner violence due to lockdowns and quarantine. These impacts are estimated to have set back progress towards economic parity of women by decades and have significantly hindered or reversed progress made towards achieving Sustainable Development Goal 5, to achieve gender equality and empower all women and girls. And an integral component of number 5 is to end all forms of violence against women in the public and private spheres. What policy responses are needed in order to get back on track to achieving gender equality, both during and beyond the COVID-19 pandemic? What is the role of grassroots organizations in supporting women who've experienced these impacts? And what can the public do to support women now? Today, I have the pleasure of introducing our panelists, who are experts in and advocates for gender equality, both within Canada and globally. And they will address these and other pressing questions and discuss key considerations in an intersectional and equitable response. Our first panelist, Rosemary Morgan, is an assistant scientist at the Johns Hopkins Bloomberg School of Public Health in the Department of International Health. Her research focuses on gender analysis, and intersectionality. She's currently leading health projects exploring the gendered effects of COVID-19 and co-coordinates an international gender and COVID-19 working group. Paulette Senior is CEO and president of the Canadian Women's Foundation. Paulette served as CEO of YMCA Canada for 10 years and has led, managed, and operated shelters, employment programs, and housing programs in a number of community organizations in Toronto. She is a former chair of the board at Women's College Hospital and currently sits on the boards of the Royal LePage Shelter Foundation and the Global Women's Funding Network. Surisha Babali is a PhD student in the Social and Behavioral Health Sciences at the Della Lana School of Public Health. She formerly worked as a project manager at the Center for Addiction and Mental Health, where she led projects focusing on improving mental health systems both locally and abroad, to increase access for vulnerable and marginalized populations. Currently, she conducts global health research regarding mental health and substance abuse, violence against women, and public health policy. Finally, I have a few housekeeping notes to run through. We're going to try to address as many questions as possible. You can direct any questions you'd like answered by the panelists in the Q&A function of this webinar. And if you have any questions after this webinar that weren't addressed, please send them to globalhealth@dlsph@utoronto.ca, and this email is also being shared in the chat box. Rosemary, I'll turn it over to you now.
Thank you so much, Janice, and thanks so much for having me here today. I'm just going to share my screen. Here we are. And greetings from Baltimore, Maryland, where I currently am based, and I'm particularly happy to be speaking with you today because I originally am from Canada, from Vancouver in British Columbia. So I'm very delighted to be speaking at the University of Toronto and delighted that working remotely allows us to connect in ways that we have never been able to before, and this being one of them. So today I'm going to speak more broadly in regards to the gendered impacts of COVID-19. So we know that COVID-19 is not gender neutral. That's why we're all here today to discuss the gendered impacts of COVID-19. Past pandemics like Zika and Ebola have shown us that pandemics are not gender neutral, and this is being demonstrated now with COVID-19 and what we're currently seeing. So women, men, and gender minorities are being differentially impacted. That's what we mean when we say that COVID-19 is not gender neutral. When we talk about the gendered impacts, we also talk about the primary short-term versus the secondary long-term social, economic, security, and health impacts related to both biological sex and to gender. And, despite evidence showing us that COVID-19 is not gender neutral, the global policy to create to and respond to outbreaks has been historically and continues to be gender neutral. And outbreak responses are consistently failing to meaningfully include gender analysis. We saw from Ebola, we saw from Zika that pandemics are not gender neutral, but now we're right back in the same position, not having learned from that. On the screen here, you can see some papers that we published this year, one in the Lancet on looking at the gendered impacts of COVID-19 particularly, then also one in Nature that really looked at the impacts on women specifically. So one project, or two projects I should say, that I'm working on are both looking to understand and mitigate real-time differential gendered effects on COVID-19 across 9 countries. And this work is supported by the Bill and Melinda Gates Foundation and the Canadian Institute for Health Research. And one of the country context is in Canada. And here you can see the website where you can visit to see more information and resources, and a very active blog if you're interested in exploring more about this topic. So I wanted to start very briefly just highlighting the gendered impacts of COVID-19 on men. And this graph here comes from Global Health 50/50, which is providing excellent real-time sex disaggregated data that you can look at across various variables. This one looks at the number of cases, hospitalizations, deaths, for example, and for every 10 females, you can see almost across the board, we see more cases of males being impacted. So in terms of being infected, in terms of hospitalization and death. On the website, you can actually look at the data by country for the countries that have data. And interestingly, in some countries this flips. And I think Canada is very interestingly one of those countries where this data flips. And we can talk in more detail about why that is, because I think it's very interesting and very context specific. But overall, on the aggregate level, we are seeing this pattern. But what about women? What are the impacts on women? Here, I've listed quite a number of them, and many of these are more of the secondary long-term impacts. We're seeing increased economic insecurity, women losing their jobs, for example, despite women making up about 39% of employment worldwide, so globally. About 50 to 54% of all jobs lost have been jobs held by women. And this is even more so for women that are part of underrepresented minorities. So African-American women or ethnic minority women. We're seeing an increase in teenage pregnancy. We saw the same thing during Ebola, especially in low and middle income countries. We're seeing a lack of access to sexual and reproductive health services, including maternal health. We'll likely see an increase in maternal mortality as well. In Sierra Leone, for example, during Ebola, the number of deaths from maternal deaths equal to and was or greater than the number of people that died from Ebola. And this is not only because of a diversion of resources away from essential services, but also because women didn't want to go to the health facility. We're seeing increased rates of domestic violence, and I know some of the other panelists are going to be speaking to that specifically. We're seeing increase in informal care responsibilities, especially as schools close. and women having to pick up that work at home. We're seeing a lack of women's voice and agency. So this is in relation to leadership and who is making up key leadership bodies. An increase in stress and mental health issues, as well as increased cases among women healthcare workers. So while men overall are being infected at greater rates, actually when we look at healthcare workers specifically, it's women healthcare workers being infected with COVID-19 at greater rates. I just want to highlight a couple of these specifically. The first one is in relation to maternal and sexual and reproductive health. And I did talk about this briefly already, the increased rates of maternal mortality that we're likely going to be seeing in the long term, as well as reduced access to sexual reproductive health, such as contraception. And this is even in high-income countries, we're seeing women reporting a lack of access to contraception. And this may be because they're unable to get to health facilities, because things are being closed down, or again, because of diversion of resources. And this is the impact on this on underrepresented minorities is even greater. And I mentioned during Ebola, we saw that increase in maternal mortality, and we're pretty sure we're going to see similar rates again with Ebola in different contexts. Here is an article that came out in August that is showing us that we're seeing similar patterns in relation to COVID-19 and teenage pregnancies. So we've seen a dramatic rise in Kenya in early pregnancies amid school closures. And what we saw during Ebola is that many of those girls never returned to school. And thinking about what are the long-term impacts in terms of gender equality in relation to that. Not only early teenage pregnancies, but also girls not going back to school. This is the point related to lack of voice and agency. This is from Operation 50/50, which is part of Women in Global Health. There we're looking at the representation of women in global health security. So this was in early days, but what you see here is the lack of women's representation on very important key bodies, despite women making up 70 to 75% of the global health workforce. And we know that representation matters. Who has a seat at the table making decisions determines what is prioritized, where funding goes. So really, with all of this, we risk losing gains made in gender equality, including in relation to the Sustainable Development Goals. We're seeing, reports that we risk going back, in terms of, I think Janice talked about it in the beginning, about risking going back, losing the gains made, particularly in relation to Sustainable Goal number 5. I saw recently a report from McKinsey that looked at financial outputs, and going back to that women losing their jobs, 54% of all jobs that lost have been jobs held by women. Women also not returning to work because of the childcare responsibilities and homeschooling responsibilities, and what that means for GDP. So gross domestic product, what that means for income. And we know that there's a lot other things that are important besides money and economics, but we also know that money speaks. So looking at those numbers and thinking about how much are we going to lose GDP-wise by women not returning to the health workforce. And the McKinsey report actually looked at as well, what could happen? How can we reverse these trends if we took a more gender responsive approach versus a gender regressive approach versus approaches sort of in the middle, and looked at and gave specific numbers attached to those. So really, we need a gender responsive pandemic plan for both economic recovery, but also for social and health. What is a gender responsive pandemic plan? Well, a gender responsive pandemic plan is one that takes into consideration the intersectoral needs of women, men, and gender minorities in all stages, both in terms of primary and secondary long-term impacts. This is something that we've just launched today, which is a brief that's actually bringing together the Hawaiian Canadian plans for the feminist economic recovery. And I do urge you to go to our website and have a look at this, because these are the types of progressive steps that we need to ensure that we don't fall back into pre-pandemic eras, or even before pre-pandemic era in terms of gender equality. So thank you very much.
Great, thanks so much, Rosemary, for kicking us off and really highlighting some of the failures from past lessons learned that we could have learned, and but we still have time to hopefully turn things around. I'm going to turn things over to Paulette to offer her introductory remarks.
Okay, I'm now unmuted. Thank you. Thanks, everyone. Thank you to the Dalla Lana School of Public Health and the University of Toronto for inviting me to this event. It's great to be here with all of you and all of you who've joined us, as well as my very honorable co-panelists as well. So it's hard to believe that we've been living with the COVID-19 pandemic for more than 7 months now. From the very beginning, we knew it would have specific gendered impacts, and that these impacts we know have already been far-reaching. Now that we're in the midst of the second wave, recovery looks distant, but we also need to be optimistic and seize the current sense of urgency for the kind of social change that leaves no one behind. So that's why the Canadian Women's Foundation is working hard to raise awareness of how the pandemic has undone progress toward gender equity. And it's also how we can work together to support women, girls, trans, two-spirit, and non-binary people in the recovery. We're focused on raising awareness and funds and advocating for action to address 4 key gendered impacts. Some of them, I think, mirror what the previous speaker spoke about, but I'm speaking of these within the national context. I'll give a brief overview of what those impacts are, then speak about our national advocacy work, and then wrap up with we'll share a link to a short video that will outline in about a minute and less than a minute and a half exactly what we're working towards. So what are the gendered or key gendered impacts of the pandemic? The first begins with increased gender-based violence. The pandemic social restrictions increased the risk of violence for women and girls and who live with abusers. And across Canada, shelters and GBV helplines and other organizations have sounded the alarm about increased crisis calls. And yet we know the full scope of the abuse and violence because our current circumstances make it more challenging for folks to reach out for help. The second impact is increased economic stress. Women's workforce participation has dropped to its lowest level in 3 decades. So, and we're currently experiencing what many have dubbed in Canada a she-cession because of the pandemic's impact on jobs, primarily held by women, particularly racialized and marginalized women. The third is more caregiving and housework. As a result of school and childcare interruptions, many women are struggling to juggle paid work with a heavy burden of care work and homeschooling. In fact, 1 in 3 women has considered quitting her job in order to help balance these responsibilities. The fourth area is reduced access to support services. Many organizations that serve women, girls, trans, two-spirit, and non-binary folks are struggling to survive. In April, the Canadian Women's Foundation, we surveyed 120 service providers and found that about 80% were concerned about their ability to actually continue offering vital community-based services. So in response to these gendered impacts, the foundation has taken action with the support of our donors, and we've been working together with the federal government, and here are just a few of the ways that we've done that. We launched an emergency nationwide Tireless Together Fund to help organizations meet immediate needs. We have been honored to work with the federal government to move about $13 million in aid to sexual assault and other gender-based violence intervention services all over Canada. In light of the increased risk to gender-based violence, we have been raising awareness about the signal for help, which is an actual signal for help that we created at the beginning of the pandemic. This is a hand signal that can be used during a video call such as this to silently show others that you want someone to check in with you in a safe way. And you can learn more about that at canadianwoman.org. And looking to the future, we have launched a series of reports called Resetting Normal, which provide a pandemic recovery plan that centers intersectional gender equality. Step one in this plan is the importance of strengthening funding for the women's sector to ensure stabilization of services that women, girls, and gender diverse folks depend on. Lastly, it's promising that the speech from the throne just a few weeks ago spoke to many of the areas where we've advocated for policy making with a gender lens, including plans for action on gender-based violence, childcare, addressing women's economic security, and systemic racism, in particularly anti-Black and anti-Indigenous racism. We're looking forward to seeing concrete next steps and progress on these promises that were made in the speech from the throne. And I think that I'll wrap up there, but do take a look at the link that will be sent to you to see our video on resetting normal. I look forward to the conversation. Thank you.
Thanks so much, Paulette, and thank you for all your hard work on behalf of women in this country. It really, I think, signals the importance of having an organization like you to hold governments to the fire and to advocate for meaningful change. And just to alert everyone, the video link has been posted in the chat function, so we'd invite you to look at it after. So Surisha, I will turn things over to you now to share some of your insights. Thank you.
Great. Thank you so much, Erica, for inviting me to be a part of this panel. And thanks to the other panelists for sharing their remarks. So I'd like to focus on one particular issue that undermines gender equality, which is violence against women. Throughout my opening remarks, I'll be using the term violence to refer to violence against women. Next slide, please. In speaking about violence, I'd like to focus on gender norms first. Gender norms are basically a set of socially created ideas that define acceptable behaviors for women and men in society. So they're basically social rules. Traditional gender norms are typically based on heterosexual and patriarchal ideas that define masculinity and femininity in very narrow ways. And this leads to dominant and subordinate roles in society. Now, traditional gender norms are widespread. They're not limited to specific countries or groups. However, they may vary based on historical and cultural circumstances, and they can actually evolve over time. Gender norms are also learned in childhood through socialization, and these norms may be reinforced by social institutions such as schools and workplaces. Next slide, please. Traditional gender norms underlie gender inequality, which is defined as providing people with different opportunities based on perceived differences associated with gender. Now, traditional gender norms and gender inequality are at the root of violence, and violence is accompanied by shifting power dynamics, either in the home or in the community, and this is particularly, this happens when there is resentment against women who challenge traditional gender roles. Next slide, please. Violence against women is defined as any act that causes harm or suffering. And there are different types. However, the majority of violence occurs between partners involved in an intimate relationship. In Canada, 30% of victims of violent crimes were victims of intimate partner violence in 2018. In Latin America and the Caribbean, 1 in 3 women have experienced violence in a relationship. Although these numbers are seemingly comparable, the context in Latin America and the Caribbean is very different and can actually exacerbate the conditions for violence. For instance, many countries are under-resourced and lower income, and some have politically unstable governments and economies. Indigenous and diasporic populations in the region have unique histories of colonial rule, indentureship, and slavery, and this results in varying experiences of violence as well. And finally, masculinity is a powerful cultural factor that has been linked to violence as well as murders in the region. Now, given the situation of violence in the Caribbean, UN Women, along with a number of other organizations, decided to explore this problem further. They released a call for proposals. Sorry, if we could go to the next slide. Given my background in global health, I was interested in this work. So I connected with Dr. Ruth Rodney, who at the time was a PhD student at U of T, and her focus for her thesis was on dating violence in Guyana. We put together a proposal and we were awarded the contract for doing the qualitative portion of the mixed method study. We spent a month in the country and we conducted 25 interviews and 13 focus groups with about 175 individuals. Next slide, please. We found that more than half of Guyanese women who had been in a relationship had experienced at least one form of violence in their lifetime. And this is much higher than the Caribbean average. Results also show that the majority of Guyanese women hold traditional values. Almost 80% of women believed that women should take care of the home. However, almost 90% of Guyanese women also believed that women and men should share authority in the household. And these contradictory ideas about gender are thought to actually contribute to violence in the country. Now, in terms of cultural norms, Guyanese society tends to think about violence as a private issue. However, the community plays a major role in the occurrence of violence. For example, gossip and lies about women's behavior among men has actually led to the encouragement of violence to protect masculinity. And it's also been used to maintain authority and control in relationships. Participants also believe that exposure to intergenerational violence as a child led to the normalization of violence in relationships. However, this violence may manifest differently in various subpopulations. For instance, ethnicity is thought to be a risk factor for violence, especially in societies where racism exists. Some participants defined gender through ideas about ethnicity, highlighting the remnants of colonial values that are present in contemporary society. Next slide, please. So based on these findings, I was really curious as to why progressive policies in Guyana were having a limited impact on violence. I decided to focus my PhD research on this topic area, with my central research question being, how well is national policy addressing violence against women in Guyana? So I chose to use intersectionality and conflict ambiguity theory to analyze the issue and to explore the influence of gender, social, and cultural norms on policy implementation. Now, if we go to the next slide, what I found from doing this UN Women's study, we found that there were the supports for violence against women were severely limited and inadequately resourced in the country. As well, there are many services that are centralized, making it very difficult for women in rural areas to access help. While I was collecting my PhD data, I learned how COVID-19 orders are actually introducing additional stressors, such as curfews, business closures, job loss, and reduced income. With limited financial resources, Guyanese women must now feed their families with little to no money, and they're also responsible for homeschooling as schools have been closed indefinitely. Lockdown policies have restricted people's movements as well. Being confined has led to stress, tension, and conflicts. For women who live with partners with a history of violence, COVID-19 orders are actually placing them in vulnerable situations as they are isolated from their social networks and other supports that they rely on. Countries that have adopted stay-at-home measures are reporting increases in calls to helplines and shelters. And we see this in Trinidad and Tobago, and we are assuming that Guyana is also following this trend. Last slide, please. So although it may seem challenging to tackle, there are simple steps that we can take to prevent and reduce violence locally and globally. Number one, examine the gender norms that you follow in your relationships with your partner and family members. For example, how do you think men and women are supposed to act? Do these ideas about gender have a positive or negative impact? Discuss gender expectations with the men and boys in your life and develop strategies to address unequal gender norms. Second, examine the type of media that you consume, including social media, television, movies, and music. Ask yourself, what underlying messages are being promoted? Do they support gender equality? If not, think twice about whether you want to support this content. Third, support organizations that focus on eliminating violence. We've heard about the Canadian Women's Foundation today, and there are many ways that you can volunteer. And lastly, fundraise for local and global grassroots organizations that assist survivors. Guyanese organizations such as Help and Shelter, Red Thread, and Food for the Poor accept financial donations from abroad. I'll just end with my last slide with links to some of the materials that I referenced.
Great. Thanks so much, Surisha, and thanks for highlighting the differential impacts on women in different countries, using Guyana as an example, and that important call to action. So just as a reminder to all of us joining, please add your questions in the Q&A section. While we're waiting for your questions, I have a few questions of my own. And so I'm going to start back with Rosemary. And so you alluded to this in the need to have pandemic plans not being gender blind. So what are ways in which we can build back better globally, in your opinion?
No, that's an interesting question, and I think a really important one. In the paper that I mentioned that was published in Nature, and we kind of presented this framework about how can we build back better? Yes, but thinking about what is needed for a gender responsive pandemic plan, in both before a pandemic even happens, during a pandemic, as well as after. So it's important that we don't just wait like we kind of did with COVID-19, despite having evidence from past pandemics about the gendered nature of such pandemics, that we don't just wait to have things in place. So having appropriate mechanisms for data collection, very, very important. Very important that we have sex disaggregated data and data disaggregated by other social stratifiers like race, ethnicity, income, age, disability, for example. And even with COVID-19, we have better data, yes, now than we've had in a really long time, but we still are to this day missing some sex disaggregated data, especially in the early days of the pandemic. And then once numbers hit to about 1,000, a lot of countries just stopped reporting sex disaggregated data. So that's number one, because how can we address a problem if we don't know if the problem exists? I could probably go on and on. It's a very big question, but I think just broadly having systems and structures in place to ensure that we have the appropriate mechanisms so we're ready for when a pandemic hits, so we know the social protection types of policies that we need. If we know women are going to be out of work, we know schools are going to be closed. What do we need to help support that? And then what do we need during the recovery phase? And I put the link into the brief that we just launched. I think Hawaii's done some excellent work on this that's actually been implemented. Canada has done some excellent work. It's still sort of in the thought process and advocacy stage of around like this sort of feminist economic recovery plan, which is much more about than the economy, but includes some really some really good recommendations of what do we need to do to build systems and structures that are better. So we're not just going back to the way things were. How can we make sure we have a more equitable space and world for everybody?
Mm-hmm. Yeah, no, I think you raised a really important point about having the mechanisms in place so we're not scrambling and having to report after the fact on those differential impacts on different groups, as you identified. Vlad, I'd like to sort of turn to you now. You alluded to this bit, but when it comes to increased risk of gender-based violence here in Canada, what can people do to help raise awareness and urge that the Canadian government take action on this very important and not new issue, but where we're actually seeing some increases as a result of COVID?
Mm-hmm. Yeah, it's absolutely not new. And I think there's much that we can do around ensuring that our elected representatives, and I'm talking specifically at the federal level, but also the provincial and municipal levels, that we're pushing them to make sure, for example, that there's a gender-based analysis on a lot of the policies and whatever things that they're putting in place, you know. So it could be from the very municipal kind of responses to the big public policy areas. We know that gender-based violence is a very complex issue. And as individuals, it's hard to know how we can actually take action because these issues seem so large. So I'd like to highlight that throughout this particular month, in November, the 16 Days of Activism on Gender-Based Violence is an annual acknowledgement of gender-based violence. And so it's apt that we're having this event this month. So it's from November 25th to December 10th. It's inclusive also, by the way, of the Montreal massacre that happened over 2.5 decades ago. So that's an important moment that we've always marked in terms of gender-based violence in our history, but we also know that earlier this year, during the midst of the pandemic, we had an even larger significant act of violence in our country. So the Canadian Women's Foundation and other organizations will be offering a calendar of different activities, critical actions that folks can take. It includes signing, for us at the foundation, you can sign on to an online letter to let your representatives know and know that you support the implementation of a national action plan on gender-based violence. And that the action plan is actually has an equity lens, which is critical, as well as other creative ways to get your colleagues and friends involved in challenging gender-based violence from the very local family level and your homes to the larger community level and beyond. So I invite folks to visit our website, CanadianWomen.org, to learn more about what they could do.
That's great. Thank you. And thanks for underscoring the importance of taking multi-level approaches to address a complex issue like this. Surisha, as our PhD student on the panel, if you were to sort of blue sky, how would you like your research results to be used? What kind of change might you imagine from the work that you're contributing to?
So, I mean, of course, ideally, I would like my research results to actually go to the decision makers in the country so that they have access to some of these, the findings. But basically, since my research focuses on exploring the perspectives and attitudes of policy actors, in order to better understand their behaviors in regards to policy implementation, I'm sort of seeing this as a crucial step towards improving supports and resources for survivors, especially, you know, in Guyana. And by understanding the diversity of experiences of policy actors, I think that I'll be able to determine the differences in perspectives between different groups. So for example, law enforcement plays a large role in implementing policy at the front lines, as well as healthcare providers. And this research will actually be able to identify any differences in perspectives in terms of policy implementation. And it will identify whether the policies that are in place are reflective of the experiences of these policy actors, as well as survivors, and whether the policies are actually relevant and appropriate to address the concerns and needs of the population. So I think that, you know, doing this kind of research will be able to identify where there might be a disconnect between the policy and the perspectives of policy implementers, and then we'll be able to address some of these gaps moving forward.
Mm-hmm. Yeah, no, I think your example really highlights the importance of having a more nuanced approach to thinking about policy and the intersectoral dimensions and the differential impacts in the different audiences for this kind of work. So thanks for contributing to that. I'm going to now turn to our audience questions. And Rosemary, there are two questions I'll just sort of pose to you, and then perhaps you can think about both of them. I'll start with the first one, which is when talking about reduced access to sexual and reproductive health, does this include the lack of access to menstrual products? So that was one question that was posed by one of our audience members. What are your thoughts on that?
Sure, yes, most definitely. It does include that. And I think there has been some work in some specific groups that are really looking at the impact of COVID-19 on menstrual health and hygiene. UNICEF is one of them, but I think there's a group out of Harvard as well, and they have a list of resources specifically on it. But I think it's due to the same reasons, like disruption in supply chains. I mean, I don't know if any of you tried to buy furniture over COVID during this time, but the wait lists are like 8 months long, or not 8 months, 8 weeks long, just because of disruption in supply chains. But what about supply chains for essential services like menstrual hygiene products? Also disruptions in access to so water and sanitation. The one thing to think about it too is menstrual hygiene for essential workers, especially health workers, those that have to wear the full body suits. Are they given adequate supplies? Are they given adequate time to address if they need to? And the answer has been no in a lot of cases. So I think it's really important that we look at these things holistically. We have to look at, there's part of these sort of very complex systems, supply chains. It's not just like, is it available in the store? It's like, do people have money for it? If you're losing your jobs, there's so much about it that does need to be addressed. And if girls are not going to school, and that's where girls had access to their menstrual hygiene products, what does that mean for the girls that are now at home?
Yeah, I think until COVID hit, for many people, those supply chains are quite invisible to us in terms of we just expect things to be present. Yet they weren't for many people even before COVID. The next question is perhaps either for Paulette or Surisha. I'll let you decide. But maybe just coming back to the Canadian context, has occupancy rates for violence against women shelters maxed out during COVID, and what that might look like maybe in Canada, and any thoughts you might have about the countries in which you've done research in, Surisha. So just in terms of how the shelter system is being impacted. So Paulette, maybe I can start with you.
Sure. So I think that is actually a really good question, because it's not one of the things that come up. You hear about the stats and you hear about the increase, but we haven't really talked about what's the impact on shelters. So I think it varies depending on where you are in the country. We know, for example, that some shelters have had to actually rent hotel rooms in order to accommodate the increased need, but also to think about the importance of social distancing within a shelter. So we know when the pandemic first hit, the major concern is, one, how are we going to continue keeping staff and women and their children safe in a shelter? And and how are they actually going to afford all of the PPEs and ongoing increased cleaning that will be required in order to maintain that safety? And so that was initially the first challenge. And then the next challenge was how to accommodate the increases. So, when the message first went out from our elected officials, provincially and federally, the message was stay home, stay isolated in order to stay safe. And then we saw that we saw a couple of things. We saw the increase in terms of call to helplines, but we also saw that women were choosing to stay home with abusers as opposed to leave. And so we had to ask that message be flexed in order to accommodate a key message that said, leave if you need to leave for your safety. And so that was an important message. And then we saw shelters do what they needed to do in order to accommodate the needs.
Yeah, I mean, it's a great example of how sort of the more blunt public health advice needs to be nuanced for different audiences given their social and economic circumstances. Surisha, any reflections on this question from your perspective?
Yes, so I can speak to what I know about the situation in Guyana. I know that the resources in terms of shelters are very limited in Guyana. So even prior to the pandemic, shelters were typically at capacity. I think from my knowledge, there's only one shelter in the entire country. That's a women's shelter. And so once the pandemic hit, of course, there were increases in calls or in calls for access to the shelter, and women had to make that decision as to whether they wanted or needed to stay at home to take care of children versus leaving the home. Now, from doing my PhD research, I spoke with a representative at the Ministry of Health who spoke a little bit about some of the calls that she was receiving and how she actually had to make alternative arrangements for some individuals so that they could actually leave their household and go to stay with a family member or friend, even though, like this was against the directions from the Ministry of Public Health in regards to COVID-19 restrictions. So, there still is a lot of, there's a lack of resources that are leaving women in these desperate situations. And, we're seeing a lot of women that are staying at home because they have no other options. So it's a pretty dangerous situation that women are in, especially if they're in the home with somebody who has a history of violence.
Mhm. Yeah, thanks for that. Rosemary, just going back to one of the slides that you showed around why do you think Canada is flipped with respect to men's case levels, sort of, and are we seeing the same trends around mortality data? Any thoughts on that?
Yeah, that's really interesting question in my experience or my opinion. And again, I would encourage you to go to the Global Health 50/50 website and look specifically at the Canadian data, because it's really interesting because there is a flip in a lot of those cases. And it's it's different from the majority of countries worldwide. There's other countries that it's flipped as well. And while we do need more data and evidence on this, yes, it is supposed that one of the biggest contributors to this is the number of deaths in care homes, and Canada's, I'm sorry to say it, poor response to that, addressing the sort of infection rates and deaths in care homes. We know women tend to live longer than men in general, right? Although they do tend to live with more comorbidities as well, which could be contributing to it. But if we knew that care homes were these high infection sites, and we know that age is a contributor to mortality, we do know all of those things, but we should have had better things in place to make sure and reduce infection rates in care homes. And that's what is to be said, one of the biggest rates why we're seeing a flip in Canada. I mean, we do need to see more data. We need to see age disaggregated data. We need to see data disaggregated by race and ethnicity, by province. I think all of that would be really important to tell really what the story is. But it just goes to show how much the targeted response and how context specific responses we need are to COVID-19.
Well, I mean, long-term care homes are a really good example of where we really have a public-private situation divide here in terms of how they're run, and also a good example of what some critics are saying, that we haven't learned our lesson from the wave one in dealing with it because we're currently in our next wave. I'm going to turn to you, Surisha, about the measures, any measures for reducing intimate partner violence in the global health context. Is there any research framework that is currently being widely utilized that talks about strategies in the context of COVID that you can think of?
I can't think of anything that I've come across in particular related to COVID. Of course, there are, gender equality related frameworks that have been, widely used to develop policies that address gender inequalities, gender-based violence, et cetera. But to my knowledge, I haven't come across anything that's COVID-19 related. Perhaps the other panelists might know.
Yeah, I'd open it up. I don't know, Paulette or Rosemary, if you are seeing any new frameworks emerging or new applications of existing frameworks might be the way to go.
It may be a little bit too early to talk about frameworks within the Canadian context. However, you know, what we knew before this pandemic hit was that we had a number of ingrained inequities that existed, right? And so the reason that we did the resetting normal is because normal was not working for many people. And so I think similarly, as we think about rebuilding to build back better, which is the refrain that we're hearing, is that it's about building in a way that is inclusive and centers those who are most marginalized. And that's what we've been pushing for, to ensure that that every single opportunity where we have to rebuild or recreate, that it's about doing that in a wholesome, fulsome way that is with an inclusive intersectional lens.
Great, thanks. Maybe I can, I think this is a question for you potentially, Rosemary, but all of you may have a thought about this. So you mentioned gendered mental health issues during COVID. Perhaps maybe elaborate on what they are, what is the cause of these differences, and what kind of policies could be implemented to really address the gendered mental health issues that are being faced.
Yeah, it's a good question, and as we know, mental health is so important and really important for us to address. And I'm hoping COVID-19 will draw more attention to it, like it has to many other situations. And CARE has done a study on this recently and found that women were, while everyone was reporting anxiety, you know, everybody experiences anxiety, women were reporting it higher. I have to caveat that saying that also may be a gender bias, because men tend to report mental health less, you know, due to gender norms, as Surisha was alluding to in her presentation. So we have to sometimes take those things with a grain of salt. But if women are reporting higher degrees of mental health, we should take notice and ask why that is. Thinking about it in terms of, I mentioned in terms of the economic insecurity and job losses, more women have been losing their jobs. But not only that, it's like a double-edged sword kind of thing. Not only are more women losing their jobs than men, but there's more women on the front line than men. More women healthcare workers, more women essential workers, and more women of color on both of those fronts. And so not only are women losing their jobs on one hand, you have this whole other part of women who are having to work quite high stressful jobs where they're putting their own health at risk. Then they have children at home, schools are closed, they have to look after their children, homeschool them. And even in families that thought that they had quite progressive gender norms, roles, and responsibilities, what COVID is showing them is no, they don't. That actually, when push comes to shove, we're falling back on traditional gender norms. So what needs to happen? I mean, it's a multi-pronged approach in the house, in the community, in the health system, at the policy level. Things about how we're allocating work at the home level and who's actually doing what and why, but also what's needed to support women in these roles in terms of childcare that's needed, in terms of sick leave, like if you're having to take time off work, in terms of the money that's going to families to help reduce some of that stress and anxiety that they're experiencing. So we need different policies at all different levels to be able to address this.
Mm-hmm. Anyone else want to weigh in on this question? Otherwise, I can move on to another one. Perhaps for you, Paulette, maybe in the Canadian context, I'm not sure if you're aware, due to COVID restrictions, clinics for safe abortions may not be operating, and whether these women may be experiencing violence, which is resulting from unwanted pregnancies, and how we might accommodate those needs. I'm not sure if you or anyone else has any comments on that.
You know, it's one of the things that hasn't gotten a lot of attention in the news or elsewhere. But you know, in some parts of our country, access in normal times is spotty, if not non-existent. And so I can only imagine that during a pandemic, how worsened that is with the combination of increased gender-based violence. You know, one of the pots of funds that we received from the federal government to distribute was to sexual assault centers, because those centers were seeing an increase in complaints of sexual abuse. And so we know that it's happening. It happens during normal times. It can only increase during COVID times. And so we know that this is an issue. We know that serious operations, medical operations were delayed or canceled during the height of the pandemic. And so I would only sort of assume that access to abortions probably also received that fate. And so that worries me a lot. And, you know, quite frankly, if I think about some of the things that will be uncovered when the isolation restrictions are lifted, it worries me about what will be revealed. And I think this is just one area.
Yeah, great points. So we only have a few more minutes, and I'm just going to invite all three of you to sort of reflect on sort of your, your closing remarks. And I'm going to combine a couple of the questions that we've received. So some of the questions have been trying to get at the building back better and how data is part of that. Other questions are asking for sort of any response around how we can better support or help women and mothers who are struggling with increased tasks, including some of the things you already were talking about, Rosemary and others, around managing home and schooling of children and precarious work situations. So any sort of last thoughts about how can we build back better, data being part of that, but also really trying to align our supports to different, at different levels and to different women and mothers. Any thoughts? You can take a piece of that question. I was just trying to honor a few of the questions. So anything around building back. So Surisha, your thoughts, and then I'll go to Paulette.
So what I was mainly thinking about is how we can build back better policies that are appropriate and culturally relevant. And one of the thoughts that I had was in regards to how there's a tendency to sometimes transplant policies from other jurisdictions with the expectation that they will have the same impact in a totally new context. And I think what we need to do is ensure that these policies are based on evidence and tailored to the needs of the particular countries or contexts that they're focusing on. So one of the things that we can do is involve people with lived experience in developing these policies and involve a variety of stakeholders to ensure that these policies, high-level policies, are translated into the proper and appropriate procedures at the front line, so that those who are actually implementing policies, let's say related to COVID-19 and gender-based violence, to ensure that these policies are relevant to their day-to-day tasks and that they're actually feasible to be implemented. And I think it's really important for us as researchers to advocate for governments, especially in low and middle income countries, to allocate funding to do this type of research that focuses on feasibility as well as implementation as well.
Okay. Paulette, any sort of last thoughts around call to action, building back better?
I can build on that very briefly. And I think of one of the slides that Rosemary showed in her presentation that had the number of women at different levels making decision-making tables, and how critical that is. Because if we keep making policies and implementing those policies without having critical involvement of women and other gender diverse folks at the table, then we're going to have policies that hit and mostly miss. And as we come out of this pandemic, do we really want to have that as a result where the policies are actually not making a difference in people's lives? Or do we want to be effective and ensure that before we are implementing any decisions, that we actually have the people who are most affected at the table giving input to that and ensuring that it's actually making a difference in people's lives? That's the critical juncture that we're at now.
Yeah, no, excellent points. And Rosemary, any final thoughts?
Sure, I would definitely agree with what by both previous panelists have said there, but I would like to end just by saying that, you know, COVID-19 is drawing attention to sex and gender and the role of sex and gender in people's lives and health like never before. There's more attention than I've seen, and I've been working in the space for quite a while now, and it's given us an opportunity to bring more attention to it. Right, to say, look, we need sex disaggregated data. Look, we need separate policy approaches for women, men, and gender minorities. And we need to look at how gender is intersecting with other social stratifiers like race and ethnicity. I would say have a look at the feminist economic recovery plans in Hawaii and the one in Canada and push and advocate for such approaches to be implemented. Hawaii has actually been implementing these. They call for a minimum wage of $25. I mean, seriously, that is like an approach that, you know, whether are they implementing it fully? I don't want to say yes, and then people quote me on that, but I was like, yes, that's what's needed, right? These are the types of things that are needed. And we have people's ears now. Write blogs, go on social media, advocate, make sure that people know that we need approaches to address the gendered impacts of COVID-19. That's the only way we're going to get this momentum, keep this momentum up, and get these policies implemented that we need.
Yeah. No, I think well said. I think this is the policy window, but also get it into plans, but make sure we actually have resources to monitor and evaluate whether those plans are actually delivering on those intentions. So on that note, I just want to thank all three of you for excellent presentations and for all of your thoughts. And thanks to all of you who joined in virtual land. We'll be following up with some resources. Some of them have been posted in the chat. And thank you again to our three esteemed panelists. It's been my pleasure. And thanks, Janice, for co-hosting this webinar.
Thanks very much, everyone.
Thank you.
Thanks, everyone.
Bye.
Thanks.